Good afternoon. And today we have a pleasure of interviewing very famous psychologist, Dr. Chloe Carmichael. Good afternoon, doctor.
Hi, it's great to be with you, Dr. Maria.
And thank you very much to our audience. If you have trouble sleeping or sleep next to the snoring partner, this program is for you. We're going to talk a lot about racing thoughts and how to make your sleep better in the sense of relationship and anxiety. And if you're a medical professional and just like us, are very passionate about making our patients feel and sleep better, this program is for you. We're gonna hear about relationship advice and advice on handling the anxiety. Please click the like and share button. And I'm gonna start with my story, how I find out about Dr. Carmichael. I actually came across two books what she wrote. One about handling the anxiety, and another one, I really like the name, 10 Commandments of Relationship. So I search and I invite Dr. Carmichael to share her expertise with us. And Dr. Carmichael has a practice in New York City, and she also internationally known speaker, and her articles were published in a lot of wonderful publications, including Woman Health magazine. So my first question to you, and I'm going to start right from anxiety because that question comes a lot among my clinical practice. So can you walk us through your 9-step technique for managing anxiety?
Yeah, sure. Thank you so much. And just a small point of correction, my dating book is called Dr. Chloe's 10 Commandments of Dating.
Okay.
Yeah. And as far as my anxiety book, which is called Nervous Energy, Harness the Power of Your Anxiety, you are correct. It has 9 techniques in it. I wouldn't say it's really 9 steps to managing anxiety because they're not necessarily, sequential. It's like a cookbook. You can do the techniques in any order and just choose whichever techniques work best for you. But really what they're about is understanding that the healthy function to anxiety is to stimulate preparation behaviors. So, a lot of times people, they have anxiety and they want to just do a breathing exercise and relax, which is sometimes fine. But sometimes the best way to relax is actually to take constructive action.
Mm-hmm. So what constructive actions can you give us a little bit more on that?
Sure. So one of the techniques in the book, for example, is called the to-do list with emotions. And so we've all heard of a to-do list. So you look at your to-do list and then you look at the emotions that go with each thing, and then you layer in a self-care plan. So let's say that you're thinking of finding a new job, for example. On your to-do list might be refresh my LinkedIn profile, update my LinkedIn profile. And for a lot of people, that might, kind of induce feelings of anxiety or I'm not good enough. And what will I say? And so the self-care plan would be to maybe book a date with a good friend of yours and do it together on your laptop over lunch at a great restaurant, just a friend that always knows how to pump you up a little bit. So you're noticing the task, which is to update your LinkedIn, the feeling, which is maybe emotions of like feeling anxiety and feeling less than. And then the self-care plan is to bring in a good friend, go out for lunch and do it together on your laptop.
No, that's a useful suggestions. It's kind of like you balancing the emotions in the same time.
But exactly. We don't always want to look at anxiety or difficult emotions as something that we just, kind of go into a bliss meditation and forget about them, because sometimes they're actually stimulating us to take constructive behaviors.
I really like how you said what anxiety is kind of a preparation emotion, like it make you analyze yourself and prepare for the next step. So I think it's a lot of wisdom in that. And as a clinician, a lot of people complain to me, but they wake up at night around 3 a.m. and they have a lot of racing thoughts. And in a way, they describe it like they get into that circle and the circle, and they circling and circling. As a psychologist, please recommend us how to make that struggle less, invasive, I would say.
Yeah, so a lot of people have that, especially people with what psychologists call a high need for cognition. So intelligent, active-minded people, their, cognitive wheels are always turning. So, and again, a lot of times what they want to do is just silence that spinning wheel. They want to say, how do I just make those racing thoughts go away so I can get back to sleep? And it's kind of like yelling at someone to relax. It tends to just make them, more activated and more nervous. So what we do is we take the opposite approach. What we do is you keep a pen and pencil, a pen and paper by your bedside table. And when you wake up with the racing thoughts, write them down so that you're actually paying attention to them to see what they are. And then the next morning, you can look at them and understand, okay, are these thoughts that are actually prompting me to take action? Like, are they thoughts like, I need to update my life insurance plan? I need to do X, Y, and Z? Or are these thoughts that are, really just not a big deal? And if it's not a big deal, the next time you wake up with those racing thoughts, you can go into some guided relaxation exercises, maybe ask your, smart home device, your Alexa. I don't want to say the name of mine or it will wake up right now, but you can ask your smart device to play some relaxing nature sounds or something like that. But you'll have a much easier time dealing with just going into relaxation mode if you can tell yourself, I've examined these thoughts. I know that the most productive thing I can do right now is sleep. And even repeating that thought, which is called a thought replacement, the most productive thing I can do right now is sleep, can actually give you mental permission to do that.
Oh, this is very nice. This is practical advice. If you can repeat it for our audience, what phrase you have to repeat to yourself when you wake up with racing thoughts?
Well, only once you've actually examined the racing thoughts first by writing them down and making sure that these are not actually important thoughts that require action. Once you've ruled that out, then you can simply use the thought replacement for yourself. The most productive thing I can do right now is sleep.
Okay, the most productive things I can do for myself is sleep. Also, what I noticed, and it actually make me, raise some concerns in me, I noticed a lot of anxiety and depression among young generation. As a psychologist, how do you explain this phenomena?
Well, I think that younger generations are certainly using social media and cell phones a lot, which is why in the previous tip, I made sure to say a pen and paper by your bedside table. So definitely don't open up your phone in the middle of the night to write down these thoughts, because then you go down this whole rabbit hole of, just other things that are trying to grab your attention. So I think young people are oftentimes just really overtaxed by the information overload, through their phones and social media and everything else. I think there's also, kind of a lot of confusing social messages with the assault, for example, on free speech and people's, terror of cancel culture. It has a lot of young people on pins and needles. They're terrified of saying the wrong thing, even thinking the wrong thing. And so, of course, all of this is producing a lot of anxiety. Also, with the decline of religiosity and spirituality in our society, those are typically sources of comfort for people. Also, the family unit is often being degraded, and typically family units are sources of stability and comfort for people. So I would encourage young people to look into all of those things if they're, looking to kind of get back to basic sources of comfort and stability.
Now, this is nice. Yeah, we would say what you recommend to go back to foundation.
Yeah,
Family,
definitely.
spirituality, religion, some people who
Yeah.
can.
I mean, also, of course, we have obesity is at a record high, and we know that obesity is 100% linked to hypertension. And so then when we look at that, alongside, say, the fat positivity movement and things like that, trying to tell young people that, it's somehow bad to, want to be fit. we're really sending them mixed messages, when in fact, actually, exercise is a great outlet of stress, and having a fit body has a lot to do with the body mind connection. One more thing, of course, is also that we're kind of medicalizing and monetizing these diagnoses of depression and anxiety to the point where it almost becomes a fad to feel like you have depression or you have anxiety, instead of understanding that, again, there's a healthy function to anxiety. It's a normal emotion. It can stimulate you to take preparation behaviors. And with depression, sometimes even just having the blues can mean that you need to sideline yourself, that you're doing something in your life that's not good for you. Maybe you're in a toxic relationship, you're in an over-demanding job, whatever it is. And one of the primary symptoms of depression is lethargy, is actually feeling a lack of energy. And the healthy function of that sometimes means that you will withdraw yourself from things in your life that are actually not good for you.
So basic advice is to have a very good ear, internal ear to your body.
Yeah, and also to be, not trying to deny or suppress or repress any part of yourself, but instead to be asking, yourself, okay, what does this mean? What is the healthy function potentially of this awareness that I'm having? And to, really have honesty with yourself about who you are and what you think and what your needs are. And that empowers you then to go ahead and get those needs filled in a healthy way.
Nice. Now I want to go to your previous book, and tell me if I say it right. 10 Commandments of Dating.
Yes, that's right. My book, Dr. Chloe's 10 Commandments of Dating.
Yes. Please share your overview, and we would like to know what actually are 10 commandments.
Sure. I mean, so obviously there's all 10 of them. So, I couldn't necessarily go through all of them, but the idea is that we're looking at dating in a proactive manner. Now, I'm happily married myself. I've been happily married for 10 years. But when I was young and single and in New York City, I was very methodical about dating because I wanted to, really find someone. And a lot of my clients in my office, were coming in for dating as well. So I came up with like the 10 basic things that I'm kind of always telling people about dating. So rule 1, briefly done. I actually came up with ways to make them rhyme so that they'd be easier to remember. Rule 1, briefly done, for example, is to keep your first dates really short, like absolutely no more than 90 minutes. And the reason for this is because a lot of people would say, oh, dating is just so exhausting. I don't have time. It's just overwhelming. And then I learned, well, that's because they're going on these first dates that last 3, 4, 5 hours, and then they're exhausted for work the next day. And then maybe they get emotionally invested and then the person doesn't call. And so the first date, you keep it short so that, you keep your time manageable, because rule 2, numbers for you, is that you should be going out with a pretty good number of people for first dates. I think of it almost like job interviews. You want to be out there checking out a lot of different people.
Can you share more? They are so,
Absolutely.
useful.
So I'll share one more, which is, rule 9, control your mind. A lot of people find that one really interesting as a psychologist. So there's a tendency when, you're infatuated with somebody and they're wonderful and you've had this first date and it just feels magical. A lot of people, they just kind of mentally relive that date, like that amazing kiss, that amazing moment. And I discourage people from doing that. You have to control your mind, because what happens is there's a part of your brain that is experiencing this as if it's really happening. And what that does is it tricks you into feeling a false sense of security, closeness, and trust with the person, because we build trust by duration and frequency of contact, especially through positive, reliable interactions. And so if you're just falsely creating that by mentally replaying a bunch of really great moments with someone, you're creating a distorted sense of closeness with that person. So that's why rule 9, control your mind, is in my book, Dr. Chloe's 10 Commandments of Dating.
Yes, no, that's a great book, and we're gonna put the link for both of your book underneath this interview, but people can, really study 10 commandments. But I bet what that commandment 9 is very challenging to put in reality. So people have to really practice that commandment 9 to make it, to make it work.
Well, but you know what? Rule 9, control your mind, does get easier if you're following rule 2 numbers for you, because when you're dating a lot of different people, hopefully you'll be having a lot of different interactions. And then there's also rule 4, search for more, which is when you meet someone that just, really knocks your socks off and you find them really exciting, the first thing you should do is make sure that you are going out with other people, because what I find is that sometimes people in my practice would do what I call becoming exclusive by default, where they just go out with somebody and it's really great, and then they don't have interest in other people, so they just go out with that person, even though that person has not asked them to be exclusive. And when a person does ask you to be exclusive, even if you're excited about it, you should still say, well, thank you, I'm really flattered, but why? Why do you want to be exclusive? Because maybe they want to be exclusive because they enjoy having monogamous sex and a reliable Saturday night date. Whereas your reason for wanting to be exclusive is because you are hoping it's a ramp to engagement and marriage, right? So rule 4, search for more, means we don't mentally or logistically commit ourselves to exclusivity with somebody until we've had that conversation. And that's why we have to just deliberately make sure that we go out with other people. Now, I do say in my book as well that these are, I call it commandments, but they're guidelines. We all know people that have gone on that one first date that lasted 12 hours and they never left each other's side and they got married, and that's great. It happens. But my book is for people who haven't been having that experience in dating. And so they want to try something more structured with more boundaries.
No, I like that. This is great. And my last question to you, we're all going through a lot of stress. That's usually stress, among the first conversation I have with the patient, usually word stress would be once, twice, 3 times mentioned. So my question to you, what are some lifetime changes that can significantly reduce stress and improve overall well-being? I know it's a very rhetorical question, but I like your practical implication. You take something what, everybody say it and make it, structured, what people can apply in the real life. So please
Yeah.
share that
Sure. I
insight.
mean, I think we all know, diet and exercise obviously have incredible impacts on our stress levels. Also, social support is a huge one. And so one way that we can multitask and make a reliable change in our lifestyle that's going to be manageable is to actually start going for walks on a regular basis outside on a cell phone call with a friend. So if you can say have a good friend, maybe even that lives in a whole other state or a whole other country, but you say, what about if every Friday at 8 a.m. we have a walk and talk catch up? And that way right there, you're getting a triple whammy of stress relief. You're getting exercise because you're walking. And if you really want to bump it up, you can put on a weighted walking vest, which is great as well. It will really increase your heart rate. So you're walking, you're outdoors, you're experiencing nature, and you're on a cell phone call with your friend, which also having a conversation while you're walking will also further challenge you on a cardio level. So that is a triple whammy. Another one of my favorite ways to make sure people, control their stress, of course, is to make sure that they're getting their sleep. So I suggest programming your phone to go black and white every night at, say, 8 p.m. So it just happens automatically at 8 p.m. Your phone goes black and white until 6 a.m. the next morning or whatever. Because when the phone goes black and white, it's a lot less enticing. That burst of color, and certainly disabling all of your notifications if possible, because you have to remember there's like $1 billion industry through those cell phones that's, trying to get your attention, trying to get your eyeballs. And all of that causes a cognitive interruption, and it takes you out of the moment of whatever you're doing. So I say own that relationship. Take care of those notifications by disabling them and program your phone to black and white at night.
Thank you very much. It was a lot of, I heard about the phone making black and white, and I actually tried myself, and it makes such a difference in my interest
Amazing.
towards the phone. So thank you very much, Dr. Chloe, for your wonderful advice. And we're going to put the links to your website and to your books, but our audience can know you better and get all this practical strategy into the lifetime. And
Thank you
hopefully
so much,
get
Dr. Maria. It's a pleasure to chat with you.
absolutely. Thank you.